Hi guys, welcome to my YouTube channel. Once again, I am back. I am Nurse Hlalis and welcome to my channel. I am back. Today I'm doing a video on danger signs in pregnancy. This is something that I have come across quite a lot in a lot of pregnant women, and it just pains my heart to see a lot of women losing their pregnancies or losing their babies because of not paying attention to danger signs. Therefore, that is why I felt that it is so important for me to do this video. In fact, in my previous video of the pregnancy series, which was on the importance of booking early in pregnancy, I did talk a bit about danger signs. But I decided that this is such an important thing that I do need to do a video exclusively for danger signs. I really want to emphasize them in this video and make sure that everyone understands what danger signs are, how serious they are, and why every pregnant woman should be able to identify them and know what to do as soon as she has or sees any signs that could mean that she's in danger or her baby is in danger. So if you are interested in hearing about the danger signs in pregnancy, to be able to help yourself if you are pregnant, or to help someone else that you know who is pregnant, I suggest that you stick around and watch this video. And if you do enjoy it, please do give it a thumbs up, please subscribe to my channel, and please hit the notification bell so that you can be able to know when I post videos. And then also, I'm really happy when I see you guys engaging with me down in the comment section. It really helps me to know how you guys are feeling about my videos, whether you're learning or whether you're benefiting from them. At the end of the day, I'm doing this for you guys, so it's really great for me to see your comments, and I really appreciate everyone that has been supporting me thus far, watching my videos and really engaging with my content. So without any further ado, let's get on to this video. Alright, so I am going to divide the danger signs into those that are emergencies, meaning that you need to go to the hospital immediately if you see them happening, and I am going to have danger signs on the other side that are not emergencies, they are non-emergencies, but you still need to seek medical attention for them. Right, so let me start talking about the emergency danger signs. If you see these things happening to you and you are pregnant, do ensure that you seek medical attention immediately. And I will also be talking about, in the different trimesters of pregnancy, when would you likely see each of the danger signs, what would they mean or what would they be signaling. And I'll also be talking about the things that do happen with pregnant women at the end of the video that women should not necessarily be worried about, and when they should start worrying. So let me go on to the first thing and talk about the emergency danger signs. Now, with these danger signs, you need to make sure that you get medical attention immediately. You don't want to waste time, and preferably, if you are having these danger signs, it would be best for you to go straight to the hospital where you will be delivering, instead of going to your local clinic if you are in the public sector. Because with these danger signs, time is very important. It matters when you can get medical care, and if you delay getting to a hospital, you might be delaying getting the care that you need that can help to halt or stop the complication before it gets worse or before it results in a very bad outcome for you and your baby. So What are the emergency danger signs? Number 1, vaginal bleeding, bleeding from your vagina. Number 2, severe abdominal pain. Number 3, severe headache and blurry vision. Number 4, fever and weakness. Number 5, swelling of your face, your fingers and your ankles and legs. I don't know which number I'm on right now, but decreased or absent fetal movements and excessive nausea and vomiting. With these ones, you definitely need to make sure that you go straight to your hospital. And with these ones, if you are pregnant and you have an antenatal card, you can literally just go to the hospital where you'll be delivering without a referral letter, because they are danger signs and you do need to get emergency medical care. Because the thing with going to your local clinic first to get a referral, you'll have to go through a whole process of queuing, registering at reception, getting files, standing in the queue again to be able to see your nurse. And really, these are danger signs. You do not need to go through that whole process. You do not need a referral letter. It's like emergency medical conditions that if you are not pregnant, you can just go to the hospital that's nearest to you, casualty, and if it's an emergency, you can be attended to. So these are sort of like emergencies in pregnancy. You can go straight to your hospital where you're going to be delivering. There is an maternal casualty. That's where you can go and they can attend to you as long as you have your antenatal card, and they can attend to you. They won't need a referral letter as long as it's an emergency. Alright, so let me talk about the vaginal bleeding. What could it be a sign of when you are pregnant? If you are in the first trimester or in the second trimester of pregnancy, vaginal bleeding that goes with severe abdominal pain can be a sign of having a miscarriage. So with some people, you will find that they will have severe lower abdominal pain without any bleeding, or they will have some bleeding or some spotting without abdominal pain. So if you have either of the two, vaginal bleeding alone or vaginal bleeding with severe abdominal pain, you need to make sure that you go straight to your nearest hospital. If you are having severe abdominal pain and it is maybe localized to one side of your abdomen, it could be that you are having an ectopic pregnancy, and that's also an emergency because the ectopic pregnancy can end up rupturing in your tubes. So an ectopic pregnancy is a pregnancy that will be forming or growing in other tissues of your reproductive system, but not in your womb. So you find that that can cause bleeding and that can rupture and cause bleeding into your pelvic region, and that's it's an emergency. So definitely you need to seek medical care for that. And then other causes of abdominal pain in pregnancy is when you are in the third trimester, above 20 weeks, and you're having this severe abdominal pain with bleeding. It could be a sign of placental rupture, meaning that your placenta has detached from the womb and you are now having that bleeding, or placenta previa, where the placenta forms on the mouth of the cervix and it causes that continuous bleeding. So these are all emergency signs, because it could mean that your baby is, if you're bleeding, it could mean that your baby is not getting enough oxygen, and that could compromise the baby's health, and you can end up having a miscarriage, or you can end up having an intrauterine fetal death. Your baby passes away while still in your womb. So that's very, 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 very important, and it's an emergency. Severe abdominal pain can also mean that you are in labor. So if you are maybe in your third trimester, it could mean that you are having preterm labor if you start having severe abdominal pain or labor pains, and you do need to seek emergency medical assistance, because if your baby is not ready to be alive, then you need to be given medication to stop the pain, and then if the baby can have a chance of surviving, then maybe they can give you medication to progress the development of the baby more quicker, and then you can deliver the baby and you end up having a preterm baby. So yeah, Those are the things that are associated with your severe abdominal pain and your bleeding. What about your severe headache and blurry vision? So that could be a sign of you having high blood pressure, which can you can have when you're having high blood pressure in pregnancy, especially if you are also having swelling of your face, your hands, and your legs. Could also mean that you're having high blood pressure in pregnancy, especially after 5 months or 20 weeks of pregnancy. You could be having a condition called preeclampsia, meaning that you have a high blood pressure and protein in your urine, and that can be something that's very dangerous as well, because it can end up leading to the placenta detaching from your uterus if your blood pressure is very high. It can also cause a woman to start having seizures or fits. It can also cause a woman to have organ damage, like to the kidneys, to the livers, and other organs in the body, because the blood pressure is too high. So it's really such an emergency. And if you are having those persistent severe headaches that don't respond to your normal pain meds, like your Panadols, and you're having swelly face, swelly feet, you need to seek emergency medical attention. What about if you are having fever and weakness? So fever or high temperature, it means that there's an infection somewhere in the body, and the woman needs to seek emergency medical attention, because if she has a high fever, she can end up having preterm labor, which would also not be great, especially if she's very early on in a pregnancy. Then she wouldn't want to have or give birth to a baby that's not ready to be born. And then what about your decreased or absent fetal movement? So it's very important that your baby is playing inside your womb throughout the day. Some sources have said that a woman's baby should play inside the womb at least about 4 times in 2 hours. So if the baby is not playing, that's something that really needs medical attention. So each woman's baby will move differently, and a woman will start feeling the baby move from 5 months, 20 weeks above, and the baby should be playing more or less the whole day. Some babies have different patterns of movement, and some babies will move a lot when the mom drinks something hot or cold, or when the mom eats, then the baby will start moving and kicking vigorously. From 26 weeks, I've heard a lot of women say that the baby is moving quite a lot, to the point that it's even painful above 26 weeks or 30 weeks. So yeah, you really want to feel your baby moving and kicking inside your womb. It's a good sign if your baby is moving. I know some women they get worried when the baby is moving, and they ask me, but the baby is moving too much, it's even painful. And I always tell them that, you know what, be happy that your baby is moving, because it's a sign that the baby is in good health. The problem comes when the baby decreases in their movements. The mom would know this, because as a mom, you end up getting used to the pattern of your baby's movements. So if your baby's pattern of movement starts changing, and you see that your baby is not moving as usual, or you see that the baby is decreasing in the movements or completely stops moving, that's an emergency. It could mean that your baby is slowly losing power, and it might be that if the baby is not moving completely, that the baby has demised in utero, or the baby has passed away. So it is important to really just monitor your baby's kicks and movements, so that if you are not seeing any changes, you seek emergency medical help, so that we can be able to assess you or see what's going on with the baby. And then lastly, on the emergency danger signs, I want to talk about excessive vomiting and nausea. I did speak about this in my previous video as well. Especially in the first 3 months of pregnancy, if a woman has this excessive nausea and vomiting, which is so much more than morning sickness, it could mean that she has a condition called hyperemesis gravidarum. And if this goes on for too long without her getting medical assistance, this could deprive the mother and the baby from getting the nutrients that they need. The woman can end up losing weight, she can end up becoming dehydrated, and that would not be good for the baby. So it's important for a woman to seek medical help for this condition, so that she can be managed at the hospital and it can be treated. All right, so what are the non-emergency danger signs? Okay, so it's things like having burning urine or painful urination. So when you pee, you notice that your urine is burning as it comes out, and you notice that you frequently feel the need to pass urine more often than before. When a woman is pregnant, and the more her pregnancy progresses, she will feel the need to pass urine more often because the womb is becoming bigger and it's pressing on the bladder. So you'll find that she can't hold as much urine as she could before, so then she would have to seek emergency medical help for this. No, not emergency medical help. She would need to seek medical help so that the urine infection can be treated, because burning urine is a sign of a urinary tract infection and it can be treated by antibiotics. And we want it to be treated because we don't want it to go untreated and end up affecting the woman's kidneys, and now she develops a more serious condition. And then another thing that a woman needs to make sure that she seeks medical attention for, you can go to your local clinic for this because it's a non-emergency danger sign, having a bad smelling vaginal odor or vaginal discharge that's yellow or green and it really smells bad or it's itching. It could be a sign that you have an STI and it needs to get treated, because if it's not treated, it can cause preterm labor, it can cause miscarriage, it can cause all sorts of things. So it definitely needs to be treated. Women who are having STIs in pregnancy, they do need to get treated and get antibiotics and get their partners treated, and advised on safe sex practices such as using condoms to protect the baby. And then another thing that is common in women who are pregnant is vaginal thrush. So you'll find that the woman has an itchy, very irritating, thick, white vaginal discharge that's like cheese-like. You can literally just do this to it because it's so thick. So it's also something that's common in pregnancy because to keep vaginal thrush away, it's a fungal infection. So to keep fungus away in a pregnant woman, actually in every woman, it's the hormones in the body that keep it away, and also there's some good bacteria that is in the vagina that stops the formation of fungi. So now what happens in a pregnant woman, because there's that change in hormones, especially estrogen, when you are pregnant, you find that women will be more prone to getting vaginal thrush infections. So they also need to be treated, and the treatment is simple. They can also be recurring though if a woman is pregnant because of the continuous change in the level of hormones. But yeah, those three things, the burning urine, the bad vaginal discharge, vaginal thrush, you can go to your local clinic. Those things can be treated there. You don't necessarily have to go to the hospital for them. At least not without going to the clinic first. But with the other things that I mentioned first, you definitely need to go straight to the hospital because they are emergencies. Alright, so lastly, I want to talk about the common things that women usually complain about in pregnancy. Things that usually a woman does not really have to worry about, but they do ask me about it. And yeah, I found that a lot of women do get these concerns, especially if it's first time moms, women who are pregnant for the first time. So as much as I've been speaking about this abdominal pain, a woman though, when a woman is pregnant, she will have some pains and aches and discomforts here and there, but it does not necessarily mean that they are having danger signs or it's an emergency. And I want to talk about stomach pains or abdominal pains that a woman can have that don't necessarily hint danger sign or hint miscarriage or hint ectopic pregnancy or hint what else, yeah, those things that I mentioned. So sometimes a woman will have some stomach pain and some cramps, lower abdominal cramps, that could be because of the uterus is stretching. because of the growing baby inside, and the ligaments are stretching, and you'll find that you'll have some discomfort, right? And then it could also mean that a woman is bloated and she has all the gas in her intestines and she just needs to pass wind, or maybe she needs to change her diet because the food that she's eating is making her bloated. Those things can also cause stomach discomfort. But as long as the pain is mild, as long as the pain is not persistent, so you'll find that maybe if the woman has been walking for a long time, she starts feeling some low abdominal pain, and then when she rests, it goes away. Or maybe if she's sleeping and she sleeps in a certain way or changes position, the pain goes away. Or if she passes wind or she poops, then it can get better. Well, that's if she was bloated or she was constipated. So as long as it's not persistent pain, and as long as it's pain that does go away, then you don't have to worry. But as a woman, if you are having pains in your stomach that are not going away, that are persistent, that are getting worse, even with your headaches, your persistent headaches that are getting worse, even with the vomiting and the nausea, it's persistent, it's getting worse, it's excessive. And then any bleeding, whether you are spotting, but any bleeding that's not going away, then definitely you do need to seek medical attention. So I have seen a lot of women, and my heart breaks so much when I see these women going through this thing, because these are things that we do educate them about, and we do give them health education on these danger signs. But you will find that still women do end up having danger signs, but because they don't act on time, then you will find that they will lose their pregnancies. This one about the baby's movements is very important, because I have come across many women who have stayed with a baby that's not moving in their stomach for a week, and they only present to the clinic maybe after a week of not feeling the baby move, and it would be too late by then. The baby would have already passed away, and it would have been like many days. And also with the bleeding, if you are pregnant, don't take bleeding lightly, even if you start by spotting. When a woman is pregnant, 2 weeks after conceiving the baby, she will have some implantation bleeding, but usually at that time women are not aware that they are pregnant. But once you are aware that you are pregnant and you are more than a month pregnant, any spotting or any bleeding, don't take it lightly, because it can start as some small spotting that will later progress to a miscarriage. So you do need to ensure that you do seek medical help. These things are very, very important, and you can really do so much to save your pregnancy. So yeah, that's what I wanted to talk about today. I really want to encourage women to make sure that they do book early, because that's when they will be taught about all of these danger signs and when to do, what to do and where to go, whether you go to your clinic or whether you go to your hospital. So yeah, and lastly, before I close off this video, I've also seen a lot of women who wait till the baby is about to come out when they are in labor. Labor pains don't just start and become strong as in now. They start small. They increase over time. The pain or the contractions, they start coming closer together. So once you start having those regular rhythmic contractions, let me make an example. Contractions that come every 10 minutes, you're having a contraction. It would be a great time for you to go to your hospital, especially when you're close to giving birth. You already know that, okay, I'm close to giving birth now. If I'm having contractions and that are being regular, then I do need to go to my hospital, because I may be in labor. It's very important, because now you will find that a lot of women, they wait too long to seek medical attention when now the labor has already progressed and the contractions are strong. And then you will find that now women will be giving birth in cars, will be giving birth in taxis. They get to the hospital, baby's already out, and they're giving birth in environments that are unsterile, unclean, that can put them at risk for getting infections. So it's really important to also make sure that when you are having labor pains now, you do present yourself to your birthing hospital as soon as possible. So yes, ladies, that's all I wanted to talk about to you today, and I really hope that you will remember a lot of the things that I spoke about today on danger signs in pregnancy, so that if you do notice any danger signs, you make sure that you go straight to your hospital. So thank you for watching this video. I really hope you like it, and please do give it a thumbs up. Please engage with me down in the comment section if you've ever seen anyone have any danger signs, if you yourself have had any, of course, if you are comfortable talking about it, and please do share my video and subscribe to my channel. Thank you so much. I love you guys all, and goodbye.